Hi, my name is Gio. I'm a second year medical student of Silliman University Medical School, and I'm a deputy chair of the SUMSA Advocacy Committee under Gender Equality. So today we're gonna talk about population. Population is a word that we are all familiar with and have encountered a lot of times. At the same time, talking about population also means looking at the issues and problems associated with it. But what do we really mean when we talk about population? In simple terms, population is basically the people, the inhabitants of a certain area that are also considered to be one of the basic determinants of demand as consumers. And in order to identify further characteristics of a population, it's important for us to create a socio-demographic profile such as age groups and sex. Profiling is essential to plan, prioritize, and implement health programs to the best interests of the people. In the Philippines, the estimated population right now is approximately around 108,800,000. According to the 2015 population census data from the Philippine Statistics Authority, the Philippines was composed of 100,979,304 persons. The overall males were recorded to be 51,041,779, which composed 50.6% of the total population, while the overall females, on the other hand, were 50,320,127, which composed 49.4%. The overall national sex ratio was recorded to be 102 males to 100 females. The population density was also recorded to be 337. The Philippines has a total land area of approximately 300,000 square kilometers. The population density of the Philippines in 2015 was posted at 337 persons per square kilometer. The population growth rate in 2017 was projected to be 1.6 from 2015 to 2020 and 1.4 in 2020 to 2025. We had a fertility rate of 3 according to the National Demographic and Health Survey in 2013. However, in 2017, the recorded fertility rate lessened to 2.7. The national crude birth rate, according to PSA, was 16.2 in 2017, compared to the national death rate, which was 5.6 in 2016. Life expectancy at birth is higher in females than males as projected by the Philippine Statistics Authority. Females at 75.4, while males on the other hand only at 70.01, projected on years 2020 to 2025. According to the 2015 population census from the PSA, the Philippines had a median age of 24.3 years, meaning half of the population is younger than 24.3 and the other half is older. The Philippines is composed by a majority of the working population, and the working population is composed of individuals between 15 to 64 years old. 63.4% of 63.4% belong to the working age population, while the young population, which is below 15 years of age, is composed of 31.8%, and the old population beyond 64 years old was composed of only 4.7%. In the field of health, this demographic profile is important to further determine the nature and extent of public health problems. So, why is it important to talk about population now, given status quo that we are stuck in a pandemic? Firstly, correct and transparent data is everything. We need correct information about the population for us to obtain the right statistics and ultimately know the status of our progress, like if we're actually winning against the virus. Second is to help women and other families. You may have heard the news that there is an increase on the number of women getting pregnant and people starting a family without putting much thorough planning. Higher fertility can lead to higher risk births such as 1. Infant and maternal mortality, 2. Poor maternal health, and 3. Poor infant nutrition. A lot of births are unintended and happen to women who do not want more children because who wants children? I'm just kidding. Getting to know the right numbers is important for us to tackle an area with a population boom. identify reasons of such exponential growth, and implement programs to lessen the fertility rate and protect these individuals, and ultimately achieve a decline in the booming population. Third is, we keep track of our economy to get data of the young and old dependency ratios, the working age group to assess the population age structure, the shape and what it looks like, to determine the employment and unemployment rate. All of this essential to correlate the impact of the pandemic to our economy, and so for us to properly formulate and apply solutions. Fourth is hospital bed population ratio, the capacity to accommodate patients in a given population. It's the ratio of hospital beds to the population, usually expressed as the number of available hospital beds for every 1,000. In 2020, the Philippines can offer up to 13.5 beds in NCR, while on Region 6 on West Visayas is 5.9. Below 5 over 1,000 bed ratio recommended by World Health Organization would indicate a big problem when cases surge, especially in provinces with decent healthcare facilities. The fifth is improve healthcare by requiring more healthcare workers, doctors to mitigate the effects, nurses, etc. of high fertility. Each year, health expenditures are higher under high fertility scenarios and eventually adds up over time. The pre-COVID cumulative difference was projected to be 55 billion pesos to be spent between 2016 to 2022. So, what does it mean when we reach a certain population? Because, of course, everything has a limit. Even our country has limited spaces when our population grows. A large population doesn't necessarily mean to be a negative value. A large population has a potential to be a great cause for economic development. But remember that, again, we have limited resources, and a larger population puts pressure on these resources that exist, thus results to overpopulation. Like what I've said earlier, the population is a basic determinant of demand. The more populated we are, the more we demand for resources in the area we live in, since there are a lot of people to feed. Overpopulation then becomes a problem and becomes bad because the consumption of resources are faster than the rate of regeneration. Hence, we need efficient and effective population control to achieve a sustainable population growth. So, after knowing all of these numbers, facts, and other pieces of information, we have identified problems that we need to solve. We need to propose solutions to deter a booming population. So if you still remember or recall, a few years ago, the Reproductive Health Bill was pushed to guarantee universal access to methods of contraception, fertility control, sexual education, and maternal care. Now that it has become a law, we should spare more effort to implement programs that help the vulnerable. We should support and intensify implementation of the programs on family planning. We should conduct more surveys and education drives on proper use of contraception and debunking myths, like continued sex education in schools. So that ends for my introduction. I hope you guys learned a lot, and I'm sorry for the background noise you heard throughout this introduction. So thank you guys, good day, and enjoy the rest of the webinar. Thank you.
Since today is World Population Day, it is right and fitting that we ask our questions to our city's experts. So, our first question, ma'am, is what are the programs and projects of the City Population Office?
Okay. Good afternoon to you guys. Since I think several years ago now, we already have major programs being implemented by the City Population Office. So actually there are two. One of which is the Responsible Parenthood Family Planning and the Adolescent Health and Development Program. So these are our two major programs. The first one has services, no? Like barangay classes for responsible parenthood or family planning. Then we have reproductive health forum for men and women, and the pre-marriage counseling. These are all for men and women. Okay. The barangay classes for on responsible parenthood and family planning has 5 topics. Okay, we conduct this to our mothers, our parents in the barangays, and of course the topics include duties and responsibilities of parents, husband and wife relationship, okay, essence and meaning of children, children's rights, and family planning. Okay. The second service, which is a reproductive health forum for men and women, have also topics such as 10 elements of reproductive health, 13 sexual and reproductive health rights, and the STI or HIV/AIDS. The third one, which is pre-marriage counseling, is done every Tuesday. This is to couples who wish to get married, no? So this is done every Tuesday, and we have lecturers from 4 offices, namely DepEd, City Social and Welfare Development Office, City Health Office, and PAPCOM. Okay, so these are our 3 services under RPFP. For our second major program, which is Adolescent Health and Development Program, we have the AHDP basic course training being given to our youth ages 14 to 24. Okay, we group them and then we conduct a 3-day live-in training, usually on a weekend, for these young adolescent age, children. Then we have the Reproductive Health Forum, which is a 3-hour forum workshop conducted to grade 9 public school students and out-of-school youth. Okay, so this involves again the young. Then the Heart-to-Heart Talk, which is a 3-hour lecture to in-school and also the out-of-school youth. Topics include the HIV/AIDS. So HEART actually is an acronym, for H for HIV/AIDS, E for early sexual encounter, A, adolescent sexuality, R for reproductive health, and T for teenage pregnancy. Okay. For the last one, we have the ladderized training for peer educators. Okay, so it's actually a 4-level ladderized training for 15 youth who will graduate as peer educators. So these are the youth who are potential leaders, and we could tap them in our lectures, in the other programs, and usually they come up successful, like they land in a good job, they become, I think there was one who became a head of office, then so levels 1 and 2 topics include review on basic course training. Level 3 is the peer facilitating and life skills training, and the level 4 is the peer counseling training. So actually, these are all our programs and services being implemented by the City Population Office.
So with regards to the programs, ma'am, kumusta man po ang pag-implement na to, or is the city being tig-help or tig-tab or tig-participate ba sila sa atong programs?
Yeah, of course. In the conduct of these different programs, of course, we have a budget from the city, and we have manpower, as you can see. We have, I think there are 9 of us here in the office, and they are being distributed into 3 areas of the city. So each team has 8 to 9 barangays assigned to her, So, of course, these programs and services are being delivered through them. Of course, we have the barangay population volunteer, we call them, in each barangay, whom we tap, to group these youth, these parents, and then we conduct the training or the service.
So for my next question, ma'am, what are the challenges encountered by their office?
By this office?
Yes,
okay. Well, course, we have problems encountered, no? Especially in our implementation. So, like, especially these days, we have a lot of youths who have gone astray, who have become pregnant at such an early age, no? Despite the advocacy we conduct, no, among these adolescent age groups. So that sometimes we become frustrated, but then again, we always look back to how they were brought up, no? Despite the advocacy, the lectures we conduct among these children or the youth, but then we also sometimes blame the parents, no? Maybe some parents are more concerned in looking for ways and means to provide for their families, no? So mostly they are out of their homes. So maybe that's one reason, or their peer group, their influence with their friends. So, but in a way, we are able to train them, to remind them, to awaken them, no, on the possibilities if they are not following or what is really supposed to be done, no? So that's why they really need to attend these different sessions, and we in our end we really tap the schools, the out of school youth, different sectors, just so we can really advocate, no? Especially the young who needs more of our advice, counseling, etc. Of course, we also have another challenge in our office. If you can see, one of our mandate is the CBMS, which is the computer-based management system. That's one mandate of PAPCOM, to come up with a computer-based data of the whole city as to the number of children, the youth, who are senior citizens, how many are pregnant, lactating, etc. But we haven't done that yet. So hopefully in the next months or the next year, the city has already allocated a budget for us to be able to come up with this CBMS. Okay.
So for my last question, ma'am, so with regards to the problems or the challenges that your office has faced with the implementation of your the projects or the programs that you have, what are the solutions that you are trying to do so that ma-address ang mga problems natin?
Well, as I've said, we have to intensify our advocacy, especially for the youth, and then we have to really tap those potential leaders in the barangays, and probably they can help their own youth in their areas, no? Of course, other challenges is we try to produce materials, no? Not just pure lecture. We give materials to our beneficiaries in the barangay for them to be able to also know through these visual aids, no, or IEC materials. Then what else? As to our mandate, we are trying to negotiate with the city's finance committee to come up with a budget so we can be able to implement this first mandate of our city planning office. As to the young, especially the young girls becoming pregnant, well, I think that's one big problem, a very alarming one, no? Not just for our city, but I think for the rest of the world, because the number is really increasing. And one problem is once they get pregnant, they don't immediately submit for prenatal care. Usually it's when during the third or the second trimester that they submit themselves for prenatal. So being young, I'm sure you know that the reproductive system is not yet fully developed, so they need to be given maybe vitamins or whatever, so they will deliver normal babies.
Okay, so before we end our interview, ma'am, you have any message to the youth and especially to us medical students on how we can help in attaining your goals and implementing your programs and projects for the city population?
Okay, probably you as medical students, you being in the young age, through this video or probably in your future classes or sa ba, you can also help advocate, sa inyong mga peer groups or your classmates regarding the outcome, of especially teenage pregnancies or acquiring HIV/AIDS, or maybe a lot more pa mga health problems that will come up, if, like teenage mothers don't submit themselves for prenatal care. So, siguro, more advocacy, through your help and your classmates perhaps, maka-advocate po mo sa yung mga ka-age, But then, away mo atong theme for World Population Day. It's about COVID-19. Aware mo? So muna itong theme for World Population Day, putting the brakes on COVID-19. How to safeguard the health and rights of women and girls now. So it still goes back to safeguarding the health and rights of women and girls now at present. So, more relate yun sa ato mga services, being done. But then, again, with this pandemic, naglisod jud mi adto sa mga kabarangayan, because we are limited only to 10 participants per group. So what we did, we coordinated with the other offices to conduct this RP, especially RPFP, Responsible Parenthood Family Planning. So we coordinated with the nutrition office for our workers there to group the mothers or the parents, and then for us to come in one of their 5 sessions. So at least we are able still to conduct this, especially the RPFP program.
Okay, so
Sige.
thank you so much for lending a part of your time for us.